everyone, and welcome to another Rush Generations Health Education Lecture. Rush Generations and our staff is delighted to be your source of information, resources, and health promotion programs that help maximize your well-being and good health as you age. Today is Wednesday, September 3rd. I'm Grisel Rodriguez Morales, Rush Generations Program Director. I'll be your moderator for today's lecture, Medicare One-on-One, one of our signature lectures that we are happy to provide every year, thanks to great colleagues like the ones that we have today. But before I present to you these colleagues, I'd like to first thank our lecture producer, Hannah Weisman. Hannah is going to help us manage the chat and other key aspects so that we can have a great conversation today about Medicare coverage and some of the latest updates. As always, we're live streaming this event via our YouTube channel. Always subscribe if you have the chance. Yeah, and we are using the video platform Zoom, which also allows us to host a good number of people who join us via phone. Thank you so much to those callers as well. For those of you on YouTube, we ask that you please use the chat function to ask questions, to add to the discussion throughout the lecture. We will make sure that your comments and your questions make it to today's presenters. And for those of you listening to the discussion via phone, you will have also an opportunity at the end of the presentations to unmute your audio so that you can ask your questions. As always, we'd like to remind you that all the information that we offer through these events, Rush Generations event, normally are for general informational purposes only. When you have something that is very specific to your needs or to your situations, always feel free to reach out to us, even through our toll-free number, or to providers that may help you do an informed decision. Okay, so in terms of our colleagues, fabulous colleagues from Rush University Medical Center and actually from our department, Social Work and Community Health, we have with us Stephanie Bailey, who is a licensed clinical social worker with over 20 years of experience working with older adults. She has worked for many healthcare organizations and nonprofits agencies, and she has worked as an outpatient social worker at Rush since 2013. She is the program coordinator for Caring for Caregivers at Rush, which is a program that we have also featured in the past. She's also a certified senior health insurance program counselor, what we call as CHIP counselor, SHIP, which offers free, unbiased information related to Medicare options. Then we have as well Sonia Serrano, another fabulous licensed clinical social worker with years of experience working with the older adult populations and their families. She comes with a background of working in the nonprofit sector and medical experience from nursing, rehabilitation facilities, and primary care providers. She's a clinician for the Caring for Caregivers program, and she's also a co-facilitator, for the monthly Family and Friends of People with Memory Loss Support Group, which we also offer in Spanish. And she's also a certified senior health insurance program counselor, as is Stephanie, always looking forward to collaborating with the community, staying informed, and continuing to educate and inform clients. So without further ado, I'm gonna leave you with them. Today, my setting is a bit weird because I've had some technical difficulties, but I'm leaving you in great hands right now.
Thank you. Thanks so much, Grisel. Hello, everyone.
Good.
Hi, I'm Stephanie Bailey. Hope you can hear me okay. And I will be discussing just the intro to Medicare 101. Then Sonia and I will go back and forth a little bit here, and you'll hear us trading back and forth. We're in the same room here. Welcome, everyone. My name is Stephanie, and I'm here with my colleague, Sonia Serrano. We're both SHIP counselors, and that is the Senior Health Insurance Program here at Rush. It's available throughout the state of Illinois, and we know you have a lot of questions, and I am making sure that everyone can see me and hear me, hopefully. And please save those questions till the end. We really appreciate you. We'll do our best. As Grisel mentioned, please, if they're very specific to your situation, we may follow up with you at a later time, and I'll let you know how to get help. For our agenda today, and that's on the next slide, we hope to give you a broad overview of your options with Medicare, understand some of the different ways to access those benefits, and help you learn ways to make this essential medical care more affordable. We've got just a few important updates to this, to Medicare that we will cover. And just briefly, an important note, things are changing very quickly. So this information is current as of today. The date of this presentation is September 3rd, 2025. For those watching it after the fact, just a note, things may change. So this is, of course, current as of today to the best of our knowledge. So our first section is what is Medicare and who's eligible? We won't spend a lot of time on this section. In our understanding, probably many of you attending today already have it, but we will do a brief overview, and I'll describe each slide. I know some of you are calling in by phone, so I'll do my best to describe. We have just a couple of diagrams after a little bit. So first, Medicare eligibility. It's available to those 65 and older who are U.S. citizens or legal resident who's lived here at least 5 years. It's also, if you're not 65 or older, it can also be someone under 65 who has been receiving Social Security disability for at least 24 months. And there is an exception for individuals with certain conditions who are under 65 and may be eligible more quickly and don't have that sort of 2-year waiting period. Again, just briefly, people age 65 and over on the next slide, and they must have 40 or more credits of Social Security covered employment. So that's about 10 years full time. And for those folks who have 40 or more credits of Social Security covered employment, they're eligible for Social Security and premium-free Part A. They must still pay a monthly premium for Part B, and that's on the next slide. I don't know if it's advancing. Thank you. So just to point out, those 40 plus credits of Social Security covered employment just means that they were removing taxes during that time, or FICA was being taken out, and that equals about 10 years of full-time work. On the next slide, I'll talk a little bit about how you can still purchase Part A. So if you are age 65 but don't have the approximately 10 years of covered work credits, you can purchase coverage if you have fewer than those 40 work credits. So if you don't have quite 10 years of full-time work, you can purchase Medicare Part A. And briefly, it can be quite expensive, so don't worry, there are ways we're going to talk about later to make this more affordable. But the amounts there are if you have 29 work credits or less, or 29 quarters basically of a year, you would have a $518 per month Part A premium. If you have 30 to 39, so a little bit more credits, but still not the full 40 work credits, it would be $285 per month. Again, these amounts have been updated for 2025, and we don't know the amounts for 2026 yet, so those are likely to change. And now I'm going to hand it over to Sonia for our next section.
Thank you, Stephanie, and thank you everyone for being here. My name is Sonia Serrano. You can go ahead and move to the next slide, please. So I'll briefly describe how Medicare has 4 parts. As you can see here, parts A, B, C, and D. And in the next slide, we'll go deeper into the different kind of parts. So you can go ahead and next slide. Thank you. So as mentioned before, these are the parts of original Medicare. We have the Part A, which covers the hospital insurance. So it covers hospitals, skilled nursing facilities, home health, hospice. Then we have the Part B, which is the medical insurance. It covers doctor visits, outpatient services, preventative services, lab tests, ambulance services, equipment, and supplies. Then we have Medicare Part D, D for drug insurance. So this part covers the prescription medication. Next slide, please. Thank you. Okay, then there's also Medicare supplements, which also known as Medigap. This is health insurance sold by private companies to supplement Medicare. It's used only with original Medicare, or also known as traditional Medicare. So you have to have a Part A and Part B. And this supplement insurance only works, only works if Medicare pays. So Medicare has to pay, and then this is supplemental that will pay. Now, moving on to the Part C. So Part C can be a little bit tricky to understand because it's known Part C, but it's an additional way of obtaining your Medicare benefits. So it combines benefits offered by original Medicare, and most of these plans also offer prescription coverage. Next slide, please. Okay, so for the callers, I'll go ahead and describe this slide because it shows two images. So the first image is of 4 puzzle pieces together, and they're describing or showing you the original or traditional Medicare pieces, puzzle pieces. So Part A connected to Part B, then there's also connected to a MedSup or a second supplemental insurance, and then connected to Part D. Now, this is the original Medicare. Then to the right, we have 2 puzzle pieces together, and this is describing and showing the Medicare Advantage, which is Parts A, B, and D for drugs, all together under one kind of bundle. And you can, next slide, please. And here's another more detailed way to look at the same information just described. We'll talk a little bit more about enrollment periods, but first we'll focus on getting started with Medicare and then go into the details of the left side here of this chart, which is also showing original traditional Medicare. And we will first cover original Medicare A and B, adding in Part D, and then optional supplemental coverage. Next slide, please. So enrollment periods. Medicare Part A and B enrollment periods. So the initial enrollment period is 3 months before the month you turn 65, the month you turn 65, and 3 months after you turn 65. And this also applies to individuals who are receiving their 25th month of disability. Next slide, please. Other times you can enroll, they're known as the special enrollment period. So it may be able to delay enrollment if you or your spouse are still working and covered by your employer insurance. So it's very, very important to check with your employer and confirm with Social Security if you're delaying Part B. Very critical. There's also the general enrollment period. If you don't enroll when you're first eligible or you miss your special enrollment period, then you can enroll January 1st through March 31st of each year. And then the Part B starts the month after enrolling. Next slide, please. And then I'll go ahead and hand this over to Stephanie.
Hello again, everyone. So just to remind you, we're now talking about the original Medicare, or for those who can see the slides, we're talking on the left side, original Medicare plus Part D plus an optional supplement. And so this just shows the original Medicare is your typical red, white, and blue card. It's a pay-per-service system. People get Medicare summary notices. They used to come every 3 months. It's now every 4 months. It just lists the services and supplies that you receive that were billed to Medicare, and it is not a bill. It's for your information. It's just a notice of what was paid. And then you can go to almost any doctor anywhere in the US. Medicare is generally accepted at most doctors' offices. There are limits on the fees that you pay, and it does cover most of your medical needs. And next, if you can't see the screen, no worries. This is a picture of the Medicare card, which most of you have, and this is what your card should look like. Some people still have their old card, which might still have your Social Security number on it. They did remove that from the newer cards, which is a real good idea because, of course, you want to be careful with losing that information. If you call Medicare and you don't have this card, since that number is a lot harder to memorize and it's got letters and numbers, if you do need to call Medicare, you can always give your Social Security number and they can find you that way. But just wanted to show you what the card looks like. So Part A is the portion of Medicare that covers hospital care. And just very briefly, in the interest of time, we will just say that it covers hospital care in many different facilities, including acute care hospitals, critical access facilities, long-term care hospitals. It does cover ambulance transportation in a very specific circumstance, so being when other transportation would endanger your health and must be to the nearest supplier of the needed services. Medicare Part A also covers home health care, being nursing, physical therapy, occupational therapy, etc. And unfortunately, what's not covered are things like private duty nursing, help in the home that's non-medical, things like housekeeping and such. Those things are not covered. And importantly, Part A also does cover hospice care. So for your Part A costs, again, this is current as of September 2025. So most people, again, do not pay a Part A premium if you have those 40 plus work quarters, being approximately 10 years of full-time work in a qualifying job. Part A expenses can include a deductible for each time you go into the hospital. So there is a $1,676 deductible that you have to pay for each inpatient hospital benefit period. And that means that you're responsible for this amount before original Medicare starts to pay. I've put a website there that this will be available on the training after the fact on the YouTube channel that you'll be able to see, but you can find some great information on medicare.gov and looking up what Medicare covers. So next I'll briefly touch on some of, yes?
Stephanie, quick question.
Yes, ma'am.
So I will be paying for the first 1,676, and then after that, the government pays, Medicare pays for anything after that.
After that,
for a
Medicare,
year.
that is a very good point. After it is for each hospital period. So if you ended up going back into the hospital, it depends on how long it is in between. If it's within a certain amount of time, you would not be hit with that $1,676 again. But we can, and SHIP can help you figure all of that out. But very good question, thank you. So it may be more than one time during a year, unfortunately.
Got it, thanks.
Part B covers outpatient services, so your doctor visits, lab services, diagnostic tests, certain durable medical equipment, and many of these can be found on the Medicare.gov website. Also in the Medicare and You book, which has been sent to you or will be sent to you if you're brand new to Medicare. Medicare and You is extremely helpful. I can say I use it all the time as a SHIP counselor and have to refer back to it because things change so much, and it's always got great information in it in a very clear way to follow. So these are just some of the Part B benefits that are available to you. What does Part B cost? So it also has a cost, of course, unfortunately. Again, keeping in mind there are many programs to help with this, but for most people, they do pay a Part B monthly premium of $185 per month. And that can be more based on having a higher income. It can be less if you have a lower income and cannot pay that. There are many programs that can help with that I'll tell you about later. People with a higher income, higher than $106,000 annually, pay a higher monthly premium. And there is also a Part B deductible. So for your outpatient services, you're responsible for the first $257 once during the year, meaning you have to pay that before Part B kicks in. After that one-time deductible is met, you usually pay 20% of the Medicare approved amount for these various services. So we have a few things here not covered by Part B. Again, long-term care, most dental care, eye exams. There's many things that unfortunately are not covered by Part B. And we'll come back to those items. And right now I'm going to turn it back to Sonia, who will discuss Medicare supplement plans. Thank you.
Thank you, Stephanie. Okay, so now we are going to talk about Medicare supplement plans. They are also called Medigap or MedSup. So as you can see, Medicare can get very expensive, and unfortunately, it's not designed to cover all medical expenses for everyone. That is why having extra coverage is very important. Now, these are not the same as Medicare Advantage plans, which we will cover in the next section. Oh, yes, so important to note, you cannot have a Medicare supplement that we're going to discuss and a Medicare Advantage plan at the same time. Okay. For most Medicare covered services, not the preventative service that we just discussed, for most of our services, you will have about a 20% copayment. It is similar to a cost sharing structure that you may have had with your employer coverage. Like with a group policy where the plan pays a certain amount and then you pay the remainder. So there are gaps in coverage. So you need a supplement to cover these gaps. That is why you may hear these plans called Medigap, also MedSup, and also Medicare Supplement. So 3 different names for the supplements. They are private plans sold by private companies to supplement Medicare. And again, they can be used only with original Medicare A and B only. Let's stay in this slide. Okay. Okay. So for Medicare supplement plans, oh, sorry. Can you go up one slide? This is good.
That one?
Yes, that one. Sorry, I was confused. Okay. So as of 2020, Medigap plans sold to new people with Medicare aren't allowed to cover the Part B deductible. So because of this, plans C and F are not available to people new Medicare starting Medicare on January 1st, 2020. If you already have either of these 2 plans or the high deductible version of Plan F or are covered by one of these plans before January 1st, 2020, you'll be able to keep your plan. If you were eligible for Medicare before the 1st of January 2020, but not yet enrolled, you may be able to buy one of these plans. And as you can see here, the plans range from A through N, and with those specific plans, C and F no longer available to new people joining Medicare. Okay, next slide, please. Okay, and you can use this Medicare supplement or Medigap with original Medicare only. So you must have parts A and B. It covers the major gaps in Medicare, and it only covers Medicare approved charges. So if Medicare pays, your supplement will pay. That has to be given. There's 10 standardized plans in most states. So the more a plan offers, the more expensive it will be. Plan benefits are identical from company to company. So the plan, whichever one you pick, does not change for any insurance, any company, private company you buy it from. It will always be the same benefits. So it may just be the price that may change, the premium. Next slide, please. Okay, enrollment period for Medicare supplements, the initial enrollment period is the 6-month period, which starts the first month you're 65 and enroll in Part B. This period gives you a guaranteed right to buy any supplement policy sold in your state, regardless of your health status. The Medicare standard supplement plans do not have a network. As long as your provider accepts Medicare, the supplement plan will kick in and pick up the extra expense. So it is a good idea to enroll in a Medicare supplement when you are first enrolled in Part B. And this basically means that companies can turn you down. They cannot turn you down during this time. Next slide, please. As mentioned before, all plans cover the same core benefits, and the state of Illinois has a guide that lists all of this information. And again, this link below, which will also be under the YouTube links and information. Next slide, please. The best time to buy a plan is again within 6 months of enrolling in Medicare Part B. And allows you to receive the guaranteed issue, so companies cannot refuse to sell you a policy or charge you more based on pre-existing conditions. If you don't buy within this period, this first enrollment period, and you want to buy later on, your health, they will ask you questions on your health, and that can change the amount you'll pay. Once a plan is selected, the plan is held long-term, so you keep it as long as possible. The annual open enrollment period does not apply to Medicare supplement plans. So once you enroll, you do not switch from plan to plan. Enrollment in that plan is completed through the private insurance company. So it's not through, it's not calling Medicare, it's calling the specific insurance companies that are selling the supplement plan and working things out with them. Next slide, please. So other ways of having supplemental coverage or additional coverage, retiree benefits from a former employer or union. So usually Medicare pays first, and then the retiree union pays second. So you must again enroll in Medicare. Employer union health plan coverage through current employer of self or spouse. So who pays first depends on your age and how many people work at your company. You may be able to delay enrolling in Part B, but you should check with your plan's benefits administrator. Next slide, please. Okay, now we're going to talk about Medicare Advantage. So the right side of the puzzle piece here. Okay. Okay, so Medicare Advantage plans are sometimes called Part C. But this is really a misnomer. If you choose a Medicare Advantage plan, Part C, you are essentially choosing a privatized version of Medicare in which you have your Medicare claims paid by a private company. This is referred as Medicare Advantage plan. Thank you. Okay, so how do they work? You may have to use doctors, hospitals, and other providers that work with the plan because these Medicare Advantage plans have in-network hospitals, doctors, clinics that they're working with. With these plans, you may get extra benefits. So emphasize on the may. Not every plan has vision, hearing, or dental, but some benefits that they do offer are the vision, the hearing, the dental. I know there's transportation, home health, but again, you have to really look into the information and the details of each plan. And select and enroll in a plan for the calendar year and then reevaluate during the annual open enrollment period of October 15 through December 7th. Next slide, please. So the monthly premiums may be lower than Medigap plans, but there are still co-pays, still co-insurances for each service. The Medicare Advantage premium is paid in addition to the monthly Part B premium. Medicare Advantage plans are now required to have a maximum out-of-pocket limit for Medicare Parts A and B services. So if the limit is met, then the plan covers the cost of Part A and Part B services for the remainder of the calendar year. Next slide. All right, in this slide, emphasize on the first and last points here. Very important for people to note that patients need to double and triple check if their doctors accept this plan before they make a change. Often a plan's representative may say, we already know all of your doctors accept this plan, but please be aware that it is not always the case. Note that original Medicare, or also known as traditional Medicare, AB, they do not have networks, meaning most doctors in the US accept original traditional Medicare. It's more universal. Medicare Advantage plans do have networks, so it's very critical to ask your doctors, do you accept this plan? And your specialist and all your medical staff that you see. Next slide, please. Because we do sometimes see patients being enrolled in Medicare Advantage plans and then not able to see their doctors, this does happen, you have a second chance to get out of a Medicare Advantage plan. So you can change during annual open enrollment, which is coming up October 15th through December 7th annually. You can also disenroll from a Medicare Advantage plan or choose a different Medicare Advantage plan every year starting January 1st through March 31st. And now I'm turning it back to Stephanie to cover Part D. Thank you.
Thank you, Sonia. And I'll be talking about Part D, and then we'll transition into what's new this year and then how to get help paying for this. And we did have a question about Part A, and I will get to that in a few moments after these two sections. So Part D is your prescription drug coverage. So for most people, this is required. So sometimes people will tell us as shift counselors, sometimes folks will say, I don't really take any medicines. I don't need Part D. Unfortunately, you kind of do because eventually there may be one or two things that you do need to take, and you can then get hit with a late enrollment penalty. So we really encourage people to take Part D when you are first eligible. So what are the various ways to get Part D? There's two types of Part D plans. One is if you are enrolled in original Medicare. So going back to that puzzle, the two different routes, this would be the left side puzzle. If you're enrolled in original Medicare, that's the left side, you can enroll in an insurance plan that covers drugs only, and that's a prescription drug plan or PDP. The second way is if you are enrolled in a Medicare Advantage plan, as Sonia just covered, most of those now include prescription drug coverage. So you might occasionally hear them called an MAPD, just meaning that's a Medicare Advantage plan that includes prescription drug coverage. So that plan would cover your prescriptions and your other health benefits. What's covered under Part D? Basically your prescription drugs. So not things like vitamins, iron, over-the-counter medications are typically not covered, but anything that you would go to the pharmacy to pick up. Each Part D plan has a list of covered drugs that they will cover at a certain amount, and that's their formulary. Of course, not all plan formularies are the same, and a Part D plan is required to give you a 60-day notice of formulary changes. The key to picking a good plan is really to use your own medication list, your specific situation, and to make sure that those prescriptions are covered well by whatever plan you pick. And Medicare.gov, we'll talk more about this, has a great Part D plan finder. What are your costs under Part D? The monthly premium varies by plan, so most people have a Part B premium as well as a Part D premium, and sometimes those other premiums as well. There is, for many plans, an annual deductible, but it varies. Some plans, many of them do have a $0 deductible, so that one-time cost that you must meet once a year. And then many of them have a co-payment or co-insurance for each medication that you're filling. That late enrollment penalty is a 1% of the national base premium. Don't worry too much about it, but just know that it's a really good idea to go ahead and enroll in Part D when you are first eligible, because there's the possibility they can add on that extra amount for each month you were eligible but didn't enroll. There are exceptions to that if you had other coverage. So, and SHIP counselors can assist you with avoiding a late enrollment penalty. So that's Part D. So I'm going to talk briefly about what's new this year. A few things are updated this year. This is all just to emphasize in Medicare and You might notice me looking down here and there. I'm holding it up because this guide is excellent. The Medicare and You 2025, it comes out once a year. And again, as SHIP counselors, we refer to it all the time, and many of these questions are answered there. And this information is all right at the front of that book. So new for 2025, lower prescription costs. So your yearly out-of-pocket medication costs are now capped. So total amount, the maximum amount that you would spend out of pocket on all those medications, the maximum is $2,000 during the year. There is a new Part D payment plan. So you have the option of spreading your drug costs across monthly payments throughout the year. So it does not mean they're any cheaper, but it does, for a lot of people, make it a lot more affordable, like getting on a payment plan for utilities, for example, where you just kind of know each month that's what it's going to be. This is a great thing that they have added. And then an additional option is they have added some options for managing mental health and well-being. So they're having expanded coverage of mental health care, such as intensive outpatient programs. So this was a great addition as well. And a few more. They have added some additional support for caregivers, including some new caregiver training services code, and also some respite only for those patients on hospice. So they do offer some respite care for caregivers for when their care recipient is on hospice. There's just these last two are changes. So for Postal Service employees, they're now met through a different benefits program. So no longer the federal employees group health plan, they have their own. And some changes to telehealth. And I will say for now, these are still covered. So this is when you see your doctor in a video visit. We've been watching this situation closely. And again, this may change as of the time that we are creating this training. They are still covered, but we're keeping a close watch on that. This is one of those things that has been discussed quite a lot. We are hopeful that they will still continue to cover those telehealth visits because it makes life so much easier in a lot of ways. Also new this year, this has been being phased out for a long time, but the dreaded donut hole, I always like to say this is the kind of donut hole we don't like, not like the ones we get at Dunkin's. The donut hole has actually closed. It no longer exists as of the end of last year. And that was that coverage phase after the initial coverage period for Part D covered drugs, when you would owe a higher or different percentage of the cost. Basically, you would end up getting socked with a lot of costs during that period of time. It was more like a drop off than a donut hole. But beginning as of this year, there's just the 3 phases of Part D coverage. You've got your deductible phase where you're paying, you've got the initial coverage period where there's the cost sharing, and catastrophic when everything is covered. It's a lot of information, and how do we learn all about this? We'll come back to that. This is very exciting. You all may have seen this towards the end of last year. So these are lower costs for certain medications that have traditionally been extremely expensive. They're still expensive, but they are a lot less. This information came from the previous administration. It's definitely subject to change. And so SHIP can certainly help with understanding what this means for you, but in general, this is very good news. So now I'm going to talk about how to make these things more affordable, and then we'll wrap up hopefully with some time for your questions. So again, this is just a recap of your costs with Medicare. So for that top portion, if you're going the route of original Medicare, so the left route on that one slide, your costs can be Part A, monthly premium of 0, so that's your premium. Part B, monthly premium of $185 for most people every month. And Part D, your average premium around 50 to 55. However, there are many plans that have a 0 premium, but you could pay that as well. And then of course your supplement varies. Then of course you've got deductibles. So these are premiums. Then if you instead go the route of a Medicare Advantage plan, your cost can be, again, Part A, nothing. Part B, you're still paying your Part B premium, even if you're in a Medicare Advantage plan. And that's, again, $185 a month currently for most people with Medicare. Part C, so your premiums for your Medicare Advantage plan can be anywhere from 0 up to around 200. I pulled these amounts. It can certainly vary and be a lot less than that, a lot more than that. And so your total premiums per month with the Medicare Advantage plan, again, would be $185 for your Part B, plus your premium for your Medicare Advantage plan. And then again, you would have co-pays for your medical care and medications. So we know that these costs can really add up. So how can we help with these costs? How can you get help? The first thing is to find out what you actually have. A lot of people aren't quite sure. They'll say, I have this supplemental plan, but then we might do a little more digging and find out it's actually a Medicare Advantage plan. If you're not quite sure what you have, we can help you figure it out, and I'm going to provide the number for SHIP. But these first 2 numbers are for Medicare and for Social Security. Social Security handles eligibility and enrollment for Medicare. So if your question is related to the date that you're going to be eligible, when you're ready to enroll, that's who you want to talk to, is Social Security. And 1-800-Medicare, I'll read the number if anybody's calling in, but it's 800 Medicare is the easiest thing. It's 1-800-633-4227. And that would be where you call with questions once you have the coverage, and that's who you can call in the fall to make changes to your plans. And again, Medicare and you can access that booklet online. It's also mailed to most people. It's available in multiple languages. Here at Rush, we have it for you in English and in Spanish, and you can find the entire thing online just by searching Medicare and You 2025. Other ways you can check what you currently have are using Medicare.gov. You do need to create a login and password if you want to do a plan finder. And You actually can still do a general search. I spoke too soon. You can do a general search without entering your personal information, but you're going to get a lot more personalized information once it has your specific Medicare number, the zip code that you live in, et cetera. So you can find a lot more personalized information that way. And a great way to check your coverage, I'll be repeating this a lot, but is to contact a senior health insurance program counselor. So SHIP is available in every state. Here in Illinois, the phone number to call is 800-252-8966 and choose the option for SHIP counseling. And they will provide you with some numbers for local SHIP counselors for you. You can also visit the State Department on Aging, and that website is there for you too. Briefly, the enrollment summary is be sure to contact Medicare or a SHIP counselor when you're first eligible for Medicare. Make a plan for enrollment based on your specific situation. For example, are you still working? Is your spouse still working? Do you have other coverage? And we can help you figure that out. It's a very good idea to keep documentation of what you decide to do and why, who you spoke to at Social Security, etc. And this is really important if you are still working past your 65th birthday and plan to delay enrollment in Part B because you don't want to get hit with that Part B late enrollment penalty. And briefly, I'll touch on some benefits for lower income individuals. As we've covered, as Sonia and I have both discussed, there are a lot of costs related to Medicare. There are so many premiums, there are so many deductibles, there's so many potentially very expensive medications. So how can we help you save money? There's a great program that's underutilized that's called the Medicare Savings Program. It helps with your Medicare Part A and Part B costs. You can call your state SHIP to see if you qualify, or you can apply online for this program. And I'll be repeating this website, so don't worry, it's going to come back up. It's abe.illinois.gov. So it's just like President Abe Lincoln. It happens to also stand for Application for Benefits Eligibility. So that's why it's ABE, A, B like in boy, E, illinois.gov. You can also apply for extra help. And just back for 1 second, I'm sorry, I got ahead of myself, but extra help is a great program that helps with your Medicare Part D costs. It allows you to have a little bit more income and savings than some of the other programs. So I really encourage you to go ahead and apply. You can apply online. All you have to do really is search for SSA, Extra Help application, and you can do that online. You can apply in person at your local Social Security office. You can call the Social Security Administration to apply. Again, subject to change. Right now, you can do this by calling 800-772-1213, and SHIP counselors can also help you apply. And briefly, I'll touch on eligibility for Medicaid. Medicaid is income-based. You can have Medicare and Medicaid at the same time, and it's a really good option if you're really finding it impossible to afford all of these costs. If you have Medicare and Medicaid, Medicaid will act like a supplement and will pick up the costs that Medicare doesn't cover. So it's a great option for folks that are really struggling to afford things. It provides full benefits for people with no other coverage. And if you do have Medicare, again, it's going to fill in the gaps for people with Medicare. Of course, as long as you go to doctors that accept Medicare and Medicaid. And there are different ways to apply. Again, the best, it's got stars marked there on the screen, is Abe, just like President Abe Lincoln. Abe.illinois.gov is the best way. That's what the office tells us. That's the best way to do it. You can do it also by still calling into Illinois Department of Human Services, and that phone number is there, 800-843-6154 if you can't see that. You can also apply in person, and there's a list of the Family Community Resource Centers, and you can still Again, as of today, apply using a paper application, which is available online too. The application can take a long time to process, so it is a good idea to start gathering those things and also to go ahead and provide the supporting documentation at the time of your application to Medicaid. And then your benefit would be kind of backdated to when you applied for Medicaid if you're deemed eligible. How do you find out if you're eligible for these programs? It's hard to keep track of the different income amounts and qualifying, limit on savings and things like that. There are many ways that you can check those things. One of them is benefitscheckup.org, and another is usa.gov, and it's a benefit finder under usa.gov, which can help show you what you're eligible for in terms of federal and state benefits. So those are two options for finding help. For prescription assistance, there are several options, and just briefly, I'll mention there are patient assistance programs, which are provided by the drug companies to help people pay for some of those really expensive medications. And in the interest of time, I'll just go to the next slide. There are many different options for finding these prescription assistance programs. I personally like rxassist.org. It's really easy to search for the name of your medication and see if there are any assistance programs. You can get the application directly from that website, and a lot of times you can just go ahead and submit it right from that site. I want to emphasize there are certain places that you can find good information and certain places that are just trying to sell you something. So I know a lot of you are getting really ruthless advertising, mail, online, phone calls, constant things that people want to sell you related to Medicare. So please don't give out your Social Security number, your Medicare number, any personal information to salespeople. Sometimes it can be hard to tell, and if you're not sure, you can call SHIP, and I will give you that number again at the end. And when you're searching online, be really careful. Of course, with the new AI in your Google search, it can be really hard to tell where that reputable information can be found. And I've noticed it's further and further down the list of results that pop up after you put in your search terms. So some reputable sources include Medicare.gov, not .com, please. They are trying to sell you something. So Medicare.gov, MedicareInteractive.org, and KFF.org. Those are just 3 examples of some reputable sources for information. When in doubt, please call SHIP. It's a free Medicare counseling program. We're not selling anything. So even though it is the senior health insurance program, like it says at the top there, it's not only for seniors, it's for any age. The only requirement is that your questions have something to do with Medicare. As a reminder, we're not selling anything. We work with consumers to help them achieve what is most important to them. For most people, that's saving money. For a lot of people, it's getting the plan that has the highest rating, the highest customer service rating. We won't tell you which plan we think is best or which plan to enroll in because we're not allowed to. And I'm honest when I say I don't think any of them are great, but I'd like to save you money, and that's what SHIP counselors are doing. To reach a SHIP counselor, again, please call 800-252-8966. And remember that open enrollment starts October 15th. We do have several of us here at Rush. Most places, and here at Rush, we can take appointments for open enrollment starting October 1, but don't call us before then because it just backs up our system. But you can call us starting October 1st to request an appointment during open enrollment. Every state has a SHIP. So briefly, it's sometimes called different things. In Ohio, it's OSHIP. In Florida, it's SHINE. And I just love that every state has their own SHIP. So for your family members and friends in other states, let them know they also have a senior health insurance program. I'm going to stop talking and open for questions. I saw one about Part A, benefit period. I can address that one first if you like, Grisel.
Yes, go ahead. I think that, well, first of all, thank you so much to both of you for joining us in every year to tell us everything about there is to know about this important benefit and all the updates. Thank you so much. As we see, it can be quite complicated, but you want to go ahead and ask a question before we open it to our callers? Go ahead.
Thank you. Someone asked about what the benefit period is for Part A. So when you have original Medicare A and B, I did check my book, just again, re-emphasizing that Medicare and You answers a lot of these questions, and it's a great resource. Oops, there it is, Medicare and You 2025. The benefit period is the way that original Medicare measures your use of hospital and nursing facility services. So it begins right when you're admitted as an inpatient in the hospital, and it ends when you haven't gotten any inpatient hospital care for 60 days in a row. So if you get readmitted during that 60 days, you're not going to get socked with that 1,600 blah, blah, blah deductible again. But if you do go into a hospital or skilled nursing facility after one benefit period has ended, it's a new benefit period, and there's no limit to how many of those in a year. So that can add up. That's the Part A deductible for inpatient hospital stays. I hope that helps.
Thank you. Okay, callers, feel free to unmute by dialing *6. Ask a question to Sonia or Stephanie. In the meantime, I have a question. Considering the growing number of older adults who are working past the traditional retirement age, are you seeing in terms of the numbers of clients that you see seeking that health insurance, senior health insurance program counseling, is it mostly people that are absolutely fully retired, or, how does that work?
Thank you, Crystal, for that question. I'll speak on my experience as a shift counselor. I do see mostly people who have retired, who turning 65. But recently, I have had like a couple cases where they're not retiring and they're needing some assistance with applying for the Part D later on. So they're coming to me already after 65. So I did want to mention it's important to go to their employer's HR and ask for that. It's called a letter of creditable coverage. Letter of creditable coverage when you're planning on not getting any more of their insurance benefits through your employer. So when you first turn 65, your employer will send you this letter. But if years have passed, then you become responsible for reminding HR, hey, I'm not retiring. Let me get that letter. So it's very important. And I just learned that recently because I was working with a case. So just keep that information in mind when dealing with that.
Yeah, I bet it's happening more and more. Okay, good. Then in terms of the traditional Medicare card, which you showed, the red, blue, and white card, once you have, instead of traditional Medicare, you have the Medicare Advantage, is that obsolete? Does that get shredded? And then you have a new card, and is that the one that usually is issued with a brand by a company? How does that work?
It's a really good question. I think your Medicare card is still important, and still hold on to that because you do still have Medicare A and B. Your benefits are being met through that other plan, through a private company, but it is still really important to have that Medicare card. You are still paying Part B premiums. Almost everyone still pays that $185 a month. and then keep that second card too for when you go to the doctor. You can show, okay, my plan is Aetna, and I'm, these are the benefits I'm using, but got to keep both. If you lose
All
your
right.
Medicare card, though, no big deal. You can call Medicare and they'll send you a new one.
Good. Okay. One more time to the colors before I move on to one last question. Going up once. All right. You mentioned that the telehealth coverage might change any minute. And considering that a lot of people, telehealth is so common nowadays, what would be the best way to stay informed, or will that your providers have a duty to let you know? Don't want any surprises. So yeah, what would be the best way to stay informed about that uncertain detail?
That's a tough one. I can try to take a stab at it. I think when I've checked, I frequently check on Medicare.gov. Again, that is my go-to for current information. You can also call Medicare if you have a visit coming up, and I would just, maybe give it a week out and call ahead of time and say, I'm just checking. Is this still going to be covered? I have a visit with my doctor next week as a video visit, and I want to make sure that's covered. And if you're in an MA plan, to call the Medicare Advantage plan a few days before and double check.
Okay, good. And you can let us know if you know. We can always, especially for our Rush Generations members, those that have also received our e-newsletter because they have an email with us, we can try to post something in our Facebook page, but also send a notification. Not every Rush Generations member has an email with us, but at least try to mitigate. So let us know, Sonia and Stephanie.
Yeah, I just told Stephanie that's a very good question, because as SHIP counselors, we have bi-monthly meetings that we attend, and that's when we get all the information given to us. So this is a great way to share it with you, because important things like the telehealth, which is really important for our participants, we want them to know this change is coming, or it's still the benefit's still out there. So I think that's a great way for us to share it with you, and you share it with your participants. We can definitely do that.
Yes, yes, yes. We are trying to mitigate any uncertainty. Okay, well, thank you so much for joining us. I think that's the end of the questions. You said you were gonna also give us again the CHIP number. Is that the 1-800-252-8966?
You got it. That's it.
You heard it here, 1-800-252-8966. Also, our toll-free number, which you're gonna hear more every now and then, you hear our toll-free number when we're telling you about upcoming programs. If something comes up for you, any questions, feel free to use that helpline as well, so that we can connect you with Stephanie or Sonia for any other details. Okay, so, one more
Oh, go ahead.
question. You mentioned the Medicare Savings Program. Do you need to apply each year, or that's one application? Medicare Savings Program.
In general, it's kept year to year. We do sometimes see people kicked off of that program, and we're never sure why. We can help you resolve that problem if that does happen to you. They will send letters to check and make sure you're still eligible for that. So the really important thing is to respond to mail from DHS if you're on a Medicare savings program.
Yes, and DHS is the Department of Human Services.
Thank you. Yes.
Nothing has to do with Homeland Security. It's DHS, the Department of Human Services.
Thank you so much. Illinois Department of Human Services, thank you so much for clarifying that. And the Medicare savings programs, sometimes you might hear them called QMB. There are a few different Medicare savings programs, but a lot of times people just call them QMB. So if you hear that, that's qualified Medicare beneficiary. If you hear that term, it's all the same thing. It's a plan that helps QMB, the plan that helps pay your Part B premiums and deductibles.
Thank you, ladies. Thank you so much. It's always a pleasure to have you with us, and just very generous with your time, and we appreciate so much all the information.
Thank you so much.
Okay, well, let us tell you about our upcoming programs. So during this month, we celebrate Falls Prevention Awareness Week. To celebrate, Rush Generations is going to be hosting informational lectures, balance screenings, and interactive group workshops to empower our community and prevent falls. For those watching at home, you can scan the QR code on the computer, that right there on the lower level left corner, or you can so that you can be directed to the flyer with all of our falls prevention programs this September, or you can call the 1-800-757-0202. That's the toll-free number I was referring to a couple seconds ago. But call us at 1-800-757-0202 to find out more about our programs and to register. Learn about your fall risk and what you can do to prevent falls at our balance screenings taking place at Rush and Southwest Senior Center. We also invite you to join a falls prevention workshop with us this September, whether it is Tai Chi for arthritis and fall prevention, a matter of balance, or Fit and Strong. Again, you can scan the QR code on the computer with your phone and be directed to the flyer, or call us at 1-800-757-0202 for more information or to register. Okay, Shaman Senior Voices aims to empower older adults to discuss what matters most to you as you age. It is important to share what matters most to you with your physician and loved ones. So Shaman Senior Voices wants to hear from you. Please consider sharing your wisdom on why it is important for your healthcare team and for your loved ones to know your goals and your wishes and what matters most to you at Shaman Senior Voices. You can go to bit.ly/record my story or scan that QR code as well. And our next lecture is going to be on falls prevention. So we hope to see you here on September 24 of 2025 at 1 p.m. Thank you so much, everyone.